So what would be potentially the main side effect of your treatment with high doses of vitamin D?
Oh, okay, we are talking about vitamin D toxicity used in high doses. So vitamin D toxicity is always dependent on increasing the level of calcium in our circulation.
So it's calcium.
Yeah, so there are two possible sources of calcium that can go into the circulation as to increase the concentration of calcium in our blood. And one is the diet, and another one is our bones. Our bones can release calcium, and diet can provide lots of calcium because vitamin D enhances the absorption of calcium from food into the circulation. Using this method, the source of calcium that can cause that type of toxicity, I'm talking about high level of calcium that can damage the kidneys and our blood vessels. The source of calcium is our diet. So what we do to prevent it is, to prevent this side effect, is reducing the amount of calcium that is in the patient's diet. So the patient has to follow a restricted, calcium restricted diet. If you have only the amount of calcium that our organism requires, you don't have excess of calcium in your diet. The more the vitamin D enhances calcium absorption, it cannot induce the absorption of extremely high amounts of calcium, because the diet is calcium restricted. In other words, there is not large amounts of calcium to be absorbed under the effect of vitamin D. So the diet is the main point. We have to, patients cannot eat foods that are rich in calcium. They can have only the amount of calcium in their diets that is required by the organism. So there will be no excessive amount of calcium absorbed, because there is no excessive amounts of calcium to be absorbed.
Is that a complicated diet?
No, it's not. The main point is avoiding dairy, milk and dairy products, some nuts, nuts in general, like pistachio, peanuts are very rich in calcium. Foods from the Lebanese diet are also enriched in calcium.
Sesame.
Yes, so whenever you have seeds, like nuts and peanuts and pistachio and things like that, you have to realize that this can provide a lot of calcium, and then you may have side effects of vitamin D in high doses.
So you prevent the toxicity of high doses of vitamin D by restricting the calcium in the diet with an easy diet to follow. Is there anything else that you do to prevent this toxicity?
Yes, the other thing is related to prevent excess of calcium release from the bones, and that is related to those laboratory results that I was talking about. We cannot increase vitamin D to a level that would completely inhibit, suppress PTH production, because when you suppress PTH production, then your patient is at risk of releasing the large amounts of calcium from his bones, and that would be the source of toxicity for vitamin D. So if you are following the laboratory tests, and the patient is following the diet and the hydration, because patients also have to drink at least 2.5 liters of liquids in general, not only water, per day, in order to make sure that if there is any excess of calcium passing through the kidneys to be eliminated in the urine, you can be sure that that calcium will be diluted by a large amount of urine.
So you prevent the possible toxicity of vitamin D with an easy-to-follow diet and drinking more than 2.5 liters of liquid every day, which from the standpoint of a patient is not difficult to follow.
Right.
What kind of numbers of autoimmune diseases have you treated so far?
Well, we estimated, we have a clinic where we have like 7 doctors using this protocol in several autoimmune disorders. And we estimated that like 4,500, around 4,500 patients have been already treated according to that protocol. So it's a large number of patients. We have also trained other doctors that are working in other cities in Brazil, and all of them, each of them are treating like hundreds of patients. So it's a quite large number of patients already treated in Brazil.
Yes. In these days that I've been seeing patients with you, I've seen very young people, I've seen older people, I've even seen pregnant women. Is there any restriction from the side of the patient?
No, as I told you, the side effect that can be possibly result from high doses of vitamin D is increased absorption of calcium if you don't suppress PTH secretion. So if you don't have high levels of calcium in pregnant women, you won't have any damage, any possible damage to the fetus. Actually, we have been following children that were born from those mothers, and we have seen that they actually have very early psychomotor development. They showed impressive psychomotor development that amazes the pediatrician that is following those children, and this certainly will have a favorable benefit, an impact, beneficial impact in their performance when they are at the school age.
So if you can treat pregnant women, I suppose there is no restriction of age. Is this treatment with high doses of vitamin D safe?
Well, provided that you follow the diet restriction, the patient is following your recommendation that he or she will not drink milk, dairy products, those nuts and other things. And hydration is also followed strictly, as you said, 2.5 liters of liquids in general per day. It's completely safe. We might have intoxication whenever those recommendations are not strictly followed. We may have intoxication when a patient gets vitamin D from a source that is not reliable, and they are actually eating or taking much more vitamin D than we had prescribed. Then they could be intoxicated because of those factors. Other things that can cause intoxication is conditions like hyperthyroidism that can enhance the sensitivity of a patient to the hypercalcemic effects of vitamin D. Taking another possibility would be taking very high doses of vitamin C that causes systemic oxalosis. That can also induce intoxication in spite of those preventive measures. But if everything is followed as I told you, I would say that it's completely safe. We had like 14 cases of intoxication out of 4,500 patients because of those circumstances, because of those coincidences that can be avoided and prevented.
Okay. So you had approximately 14 cases of vitamin D intoxication out of almost 5,000 cases total.
Yes.
Has there been any case of really serious situation or damage to these people?
Yeah, because we diagnose intoxication very early. All cases we had recovered completely with no kidney damage.
Okay.
So all doctors that intend to use this protocol have to be also trained on how to early treat signs of intoxication. But what's important to say is that none of those 14 cases had permanent damage to any part of their organism, including their kidneys.
Yes, I think that's important because I was personally trained in medical school to have fear of vitamin D toxicity. And you are saying that there is no real serious case of permanent damage with out of 5,000 cases.
Yes, if you follow the precautions that we were talking about, yes.
Exactly. How long is this treatment?
We started, this protocol did not start as it is now. As you said, all doctors, not only you, but all doctors worldwide advise them against toxicity of vitamin D, and so were we. So when we started using vitamin D, we started using a physiological dose that was 10,000 units per day. We were increasing the doses progressively as we become more and more confident about what we were doing, especially when new information appeared in the literature, and also according to our experiences looking at the laboratory results. Those were evidences that showed those patients were vitamin D resistant. And then the protocol became as it is now, or approximately as it is now, from 2012, but we started on 2002. So the largest dose that we have used is from 2012 up to now, that we are by the end of 2015.
Yes. How long would you say normal treatment would take?
Okay, we have a protocol where patients coming from Brazil, they have 4 appointments within a period of 2 years.
2 years, okay.
At the end of this period of 2 years, they are discharged from our clinics. It doesn't mean that they are cured. It doesn't mean that they can stop taking vitamin D. It means that their disease is suppressed. They are not cured, but their disease is completely suppressed. They are free from that disease. They are free from symptoms, free from further damage caused by immune system. As long as they keep the same dose that was regulated, tailored for that patient, specific patient.